Hi, so this is for the spiritual care final presentation. So I want to start with the 3 of Raymond's stories that really impacted me this semester. First, I wanted to talk about the story Finding New Eyes, and this was the story about the surgeon named Josh, who after many years of working in healthcare had become cynical and depressed. And he met with Rachel, and in this story she showed him how powerful self-reflection can be, and especially in the life of someone who works in healthcare and might be burnt out. And in this story, Rachel encourages Josh to ask himself 3 questions at the end of every day and think about the encounters he had with his patients and ask himself, what surprised me today, what touched or moved me today, and what inspired me today. And at first he wasn't able to come up with anything. He was saying, oh, nothing. And then the more that he kept at the journaling, he realized that he was able to think of answers to these questions. And moving forward after that, he was even able to notice these things during the encounters with the patients, not even waiting till the end of the day. And I think this story is very good, and it shows that incorporating self-reflection into his daily life transformed Josh's passion for his career as well as his attitude and mood and his general personality. And I like this story, and especially because I think it's something that I can use going forward into the start of my career. And I imagine at some point in my career I might start to feel burnt out, and I want to incorporate self-reflection into my daily routine. And this is something that our PA program has been encouraging in our weekly journals, to self-reflect every day about what we thought we did right or wrong in our encounters with our patients, as well as incorporating Rachel's questions. I think would make that even more useful. And I think that doing this will be able to keep my mind fresh and keep my passion for my career going. The next story I wanted to talk about was called Pearls of Wisdom, and this story, Raymond was talking about how oysters can turn pain from a grain of sand into something beautiful. She talks about the general process of how oysters can form pearls and how they have the soft muscle inside of their shells, and sometimes a grain of sand can get in there and start to irritate the muscle. And instead of becoming tough and callous, the oyster forms kind of a translucent film over this grain of sand over and over and over again, and that's how you get a pearl. And I think this is an analogy that translates well to living life in general, as well as working in healthcare. And working in healthcare, one can experience heartbreaking situations or just be in difficult situations. Maybe you're hurt by a patient, something they said to you, or one of their family members, or unfortunately even the way coworkers can treat you sometimes, or if something they say to you. And so people have always said that to work in healthcare you have to have thick skin. And that might be true, but at the same time it might be okay to not have thick skin and to stay kind of open and vulnerable instead of just responding back with, aggressive or just tough and uncaring responses. I think it's especially what Rachel is trying to say in this story, is that it's okay to stay kind of soft and open and vulnerable, because you can take those experiences, the heartbreaking cases or pain that you encounter during the job, And the way you respond to that, you can turn your experiences into wisdom instead of just creating a barrier between you and the patients and coworkers and family members. The next story I wanted to talk about was called When Somebody Knows. And in this story, Rachel discusses a difficult time she was experiencing with her Crohn's disease. She was experiencing really distressing symptoms and was worried that something was going on in her body. And she consulted doctor after doctor about the symptoms she was having, and they all dismissed her because they were unable to find something that was abnormal with her. And at the point where she was really frustrated and about ready to give up, she tried one final doctor, and she met with Dr. Smith. And Dr. Smith was different than the other doctors, and he took the time to sit down with Rachel and listen to her story, the symptoms she's been having, and what she was concerned about. And after that consultation, she said it only took about 9 minutes to tell her whole story. But Dr. Smith was unable to give her a definitive diagnosis. And he wasn't able to come up with a very intricate, regimented treatment plan to fix what was going on because he didn't know. But he listened to her, he acknowledged her concerns, and he comforted her and let her know that he was going to go through that process with her, and that they were going to wait together to find out what was going on, and that when they found out that he would help her through it. And I really liked this story because I think something that was emphasized in this class this semester was that we don't necessarily always need to fix our patients. And sometimes we can do more for our patients by just sitting down with them and listening to them and interacting with them person to person and listening to what they have to say, acknowledging what they're telling us, what they're worried about, and show them that we're listening to them and that we care about what they have to say. Next, I want to move on to the other resources we had during this class that impacted me. And I wanted to talk about the story of Jenny, and we were able to see the last scene during this module. And I liked the story of Jenny and watching Sam the PA, how he interacted with Jenny and her family members and did a good job to take care of all of them. And I thought he showed a good example of how a provider, a healthcare worker, can interact with a patient at the end of life and their family members that are in a difficult situation. And he showed things that were important for us to remember to do in these situations and how to act when we're working with patients who are facing the end of life. Sam was very honest with Jenny and her family about her diagnosis and her prognosis, but at the same time, he was very kind and compassionate with Jenny and her family and very patient while discussing options with Jenny and her family. And one of the things he did is that he listened to everything that Jenny had to say and her family members had to say and acknowledged their fears and their concerns about the situation. And Sam also empowered Jenny to make a decision when she was able to communicate what she wanted for the end of her life. And something else that I noticed from the videos is that Sam did a very good job of communicating to the family that he was available to them whenever they needed him and where they could find him. And so this story really impacted me because Sam, I think, did a good job of showing what I would like to be like when I am in my career and working as a PA. Next, I wanted to talk about the article Love Has a Speed that was included in this module. And in this article, the author was talking about how God is a 3-mile-an-hour God. And she says this because they said that God is love and love moves slowly. Therefore, God moves slowly because of his love for us. The author also mentions that if time were equivalent to something like money instead of love, it would move a lot faster. And so an increased speed would translate to a larger amount of money. So in present-day medicine, I think, especially with the large healthcare organizations, they encourage quick appointments with fast and easy documentation so the providers can squeeze in as many patients as possible in a fixed amount of time. And I think this seems to show that providers, or at least to the patients, it seems like the providers are rushing through their appointments with their patients and just putting it in the billing codes that they can charge as high as they can to make as much money as they can for the practice. But I think going into this field mindfully and choosing to slow down with our patients and talk to them and listen to what they have to tell us and interact with them person to person, we can better show them that we care about them and their health and not just physically while they're sitting in the exam room. And something else that I liked in this article is that the author said that moving slowly doesn't mean that one is lazy, but it's showing that what they're doing is controlled and intentional and that they care about what they're doing. Lastly, I wanted to talk about the article called Exemplary Figures of Care. And I remember I really was impacted by the story of Mother Teresa in this article. And Mother Teresa was talking about what is needed to be a good missionary. And she says, "Give Christ to the world, do not keep him for yourselves. And when you do it, use your hands." And she also said, feed them, wash them, touch them. And she really emphasized caring for the patients, for all their needs. And I think I really like this because it's really easy for a provider to just kind of stand in the doorway of a patient's room and briefly talk to them. And on that, briefly come up with a plan to fix the patient, all without really having interacted with them on a real level. And Mother Teresa said that it is more important to touch than to cure. The hand that touches heals because it caresses, it brings back trust, it offers acceptance, and manifests care. So what I took from this is, going into my career, I really want to make sure that I don't think that any task is beneath me. I want to help my patients in any way I can. And whether that's, doing regular provider tasks such as prescribing a medication, or to helping, a patient get out of their chair, put on their coat, to just do anything I can to make them feel comfortable and show them that I care more than just their physical health while they're sitting on the exam table. And a story from my clinical rotation that I thought fit really well with the themes of our class this semester. It was a story during my pediatrics rotation. I was able to observe a new mother giving birth to twin boys. However, they had learned just the day before that one of the babies had demised in the womb. And so this was a really interesting case, but also a really sad one. And the patients were in a bittersweet situation. They were filled with joy to have a new son, but also grieving the loss of their other son that they didn't even get to meet. And so they would come into the nursery to see their son and hold him and feed him. But then after they left, they had to go make funeral arrangements for their other baby. And for me, this experience was very humbling because it was different than all the other situations. And it really reminded you of what can happen in the medical field. And I couldn't imagine how difficult this situation was for these patients, but especially watching my preceptor interact with the patients or with the parents. And he did a good job, and I thought it was interesting to see how honest and straightforward my preceptors could be, but also at the same time being kind and compassionate while working with them. So I think that's it. Thanks.